This is Dr. Roger Ray. I'm Chief Physician Executive with the Chartis Group. In our ongoing series of having discussions with top-tier APP leaders through the country, we're delighted today to have Karina Stakutris with us. She's the Director of Advanced Practice at the Hospital of the University of Pennsylvania. She also is a co-author with many of us on a recent piece we published about capturing APP value. Karina, thanks for being with us today, and we appreciate you taking a little bit of time to have us continue our conversation. Anything that you're sensing is changing, either across the country or for your organization related to APPs?
Certainly, like many organizations around the country, we were able to use APPs very dynamically as things changed on a day-to-day basis and sometimes multiple times within a day. And so that really created a lot of visibility here around what APPs could do. And that's been really exciting to be recognized and to be seen in that way. I think what it has created is a real call for leadership around advanced practice and infrastructure around advanced practice, some of the things that you and Chartis have alluded to in the publication. And so it's been fun to kind of take a step back and start to think about the future work to build some of that structure to develop local leaders at the clinical level and then organizational leaders of the future.
What are some of the heaviest dots to move?
Yeah, I mean, it's an incredible group of people that you've assembled, by the way. They're some of my mentors and the people that inspire me most across the country. So it's really fun to get to partner with them in this way. I think one of the trickiest things, and I might be looking at this through the lens of an academic medical center, but I think one of the trickiest things for us, and I'm not sure that we're that different than anybody else, is how to attribute the work and the outcomes of an advanced practice provider to an individual advanced practice provider or to APPs in general. And, when people start talking like that, they automatically go to things like, well, billing and productivity and those kind of really objective, tangible things. And clearly they matter. I think that's important in the provider mindset to establish that. But even beyond that, like what outcomes are the APPs driving? How do we distinguish their contribution to the care of a patient or the value at an organizational level? And I think it's nuanced and I think it's complicated, and it's not as easy as who's dropping the bill, though I think that's clearly an important element as well. So I have a very strong position that APP attribution is a nut that I'm not sure people have fully cracked well.
I think, just to double down on what you said, my experience, for those who desire to be data-driven in their decision-making, for nobody's intent necessarily, probably because of, to your point, the clinical use of administrative data as compared to clinical data per se, many APPs are invisible within the overall measurement capabilities of an organization. That varies a little bit system by system, varies a little bit IT vendor by IT vendor, but in large part, if we have a certain amount of information on clinical and operational data for physicians, for APPs, it's a fraction, and we're not going to get anywhere of really making improvement just for the transparency, let alone, if you assume, good people notwithstanding, that there's a bell-shaped curve in nearly any dimension of performance out there, people are really challenged, other than word of mouth and observation, who's at which end of which curve, right? And that just has to be remedied. I'm not sure has really caught the urgency of the vendors, quite frankly, let alone the local practices of how to capture it, right? But we will plateau or top out on the ability to continue to improve, or prove the case as well, if we don't make the unique contributions more visible from a data point of view. Completely agree with you. As you think about the next, obviously you've got this huge facility and the capacity changes and building new that's coming at you. Anything else about the next 18 months or so that you think requires a shift in direction or an added emphasis for you about the continued growth of tapping APP value in your organization?
It's really about building the right structure for the future for us here, and kind of formalizing some of the processes that we have, and kind of grounding them in a more data-driven approach. We are hiring a ton of APPs. We have a ton of APPs. That's a large financial investment for us as an organization. And so without being able to sort of represent what the other side of that looks like, which gets back to the point about attribution and outcomes, it feels like a lot of spend. And so I think, and I'm just not talking dollars, I'm talking energy and resources and things like that, clearly dollars. And so I see my work in the next 2 to 3 years to be around, obviously hit these deliverables of the next, 6, 9 months or so, and then really, again, take a step back, adapt our infrastructure, create capacity for future leadership, build some other elements into our org chart that are bigger than just team leaders for advanced practice providers, right? And so when you think about at whatever organization someone might be at, a department of medicine, a department of surgery, they have other shared resources within the department that aren't just around the people, but about the work of a department. And so I'm trying to think about how to build resources around professional development and practice and diversity and equality and inclusion and research and all of those things that we participate in, but aren't embedded within the culture of an advanced practice infrastructure. And so my head has really been in that space for a while. I think I really recognize those were the things we were missing here. And I think that would be a fun way to spend the next couple of years.
Well, I think certainly, many are learning their own version of, if you try to innovate on frontline work without frontline folks engaged in the proper way, you are blind to their experiences and observations. You lose their unique contribution to the finished product, and you probably mess it up, in simple terms. And so the recognition that APPs working every day have unique experiences and unique opportunities and contributions as a building block to innovating on the care model. It's just sounds basic, but it's not done so thoroughly many places, And so when you get a chance to interact with somebody who's brand new to leadership, or their organization is on the front end of trying to think through strategically what to do, what not to do, how to do it, any pearls for those leaders or for their organizations?
Yes, it's a timely question, because I just so happen to be mentoring and working with someone who's exactly in that position. It's at an organization that is not formally affiliated with Penn, but the particular program is. And so it's reminded me of what it's like to step into a space where there is no organized advanced practice infrastructure or leadership, where you're trying to communicate your values and your priorities and your vision for advanced practice to people that have really never seen APPs as leaders before. They've seen them as at the point of care clinical workers. And so, I'll just share some of the specific tactical things we're talking about. Is how do you form an APP council? How do you just bring APPs together to start talking about stuff? The things we're talking about that we've been able to accomplish here obviously didn't start here, so it started with just a room full of engaged, interested APPs who wanted to see something different and started to do that work. So how do you find those people and bring them together? I think that's a question I hear all the time. there's even things like, how do you, I promise I won't talk dollars. How do you bring people together around compensation? How do you get HR to engage with you as an APP leader around, hey, where do we want to be in the market? How do we identify our market value? How do we compensate this work? Is it salary? Is it hourly? Is it incentivized? And I think that's a space that's very unfamiliar to most frontline clinicians, regardless of what initials you carry. And when you have to start engaging and advocating and trying to understand, it gets really tricky. I think finding a way to have a seat at the table and to be seen as a stakeholder in the conversations is tricky in a new environment. It's a little bit of an art. And I think when you come from a clinical space, you make a lot of mistakes because you think things happen on clinical times or in the way decisions are made clinically. That's often not how things happen around a boardroom. And so learning to recognize your own style, recognize how to engage with different types of leaders who aren't other advanced practice providers or nurses or physicians, but are maybe CFOs or CEOs or other executives, takes some time and is often bumpy for us as clinical leaders because we don't really have that kind of leadership training. I'm sure there's dozens more. Those are the couple of things that are top of mind that I've been having conversations with this colleague around.
Sure. Well, I completely agree with the pearls you mentioned there. I would add a couple. One is every organization, whether it knows it or not, has a reputation with the APP community about how knowledgeable they are, how engaged they are, how forward-thinking they are about APP practice and where it's going. And we often find that once an organization seeks to understand what their reputation is, let alone begin the journey toward improving it, which everybody thinks strategically will be important, you learn lots of things exactly like you've said. Second, as we said on the webcast and in the paper, if you're really looking to deliver better care at a lower cost with better access and engagement for patients, there are very few big levers to pull. You have a lot of little things you can do, but there are very few big ones. One, obviously, in the IT age we're in, is to expertly adapt technology to those purposes. And you can change incentives a little bit, but we still feel strongly that one of them is to innovate on the care model itself. And APPs just have to be making their unique contributions, if not in many cases, just leading that effort. And so for those who are strategically minded or growth minded or, future minded at all, if you're not engaged in pulling this particular lever, I think that ought to probably give you pause.
I think you're spot on around the point you just made around the model of care and being innovative and kind of, I don't know, maybe willing to take some risks to disrupt what is, for many of us, deeply embedded culture and kind of the status quo. And so I couldn't agree with you more about that point.
Great. So in closing, I just want to say to the audience, we're grateful for Karina and her leadership, as well as that of her organization. They've done many great things there at Penn, and you should please take note. You can obviously tell from this conversation how capable she is and what a great leader she's been at that organization. And we appreciate the opportunity and her willingness to sort of spread that nationally. As always, thanks for your time and have a great day.